So when do we use chemotherapy on our cancer patients? Well, first of all, cancer is typically treated with possible surgery if it's in one location, chemotherapy to shrink tumor burden, and or radiation. So they may have a combination of those three things. But when do we use chemotherapy? I only use chemotherapy when I need to shrink tumor burden. For example, if you are diagnosed with colon cancer and it's traveled to the liver, which is its typical first location, I would shrink the tumor burden down to as small as area as possible so that surgery can be accomplished. For example, if a woman has breast cancer, and she has a lump, but it's gone into her lymph or she's gone into a distant organ, we need to shrink the scope of the problem from here down to a surgical option. Patients oftentimes will decide to do low-dose chemo because they don't want to do full-dose chemo because of the side effects. And that's what we do here in the clinic. We use a 10% dose added with insulin. Cancer cells have insulin-like growth factors on their receptor sites, and so what we do is we use insulin as the escort to bring the chemo in to the cancer cell, preserving your other cells. In conventional chemotherapy, they use their typical dose, and what I tell people, if they're going to choose conventional chemotherapy, you should be on a program to cooperate with taking care of your body and supporting your body while you are getting chemotherapy. So low-dose chemotherapy actually has been around for about 70 years, and it was started by Dr. Donato years ago. And low dose is using 10% of a typical dose of chemo. What we do is we give the patient insulin. Why do we give the patient insulin? Because cancer cells have sugar receptor sites stimulated by insulin-like growth hormone. And so what we do is we prime the cells so that they are hungry to get the chemotherapy and preserving the cells that don't have cancer.